I'm Nadja Reissland, and I'm a psychologist. I work in Durham University, and what I'm presenting to you today is like to show you a little bit how I do my work, but also to see what you think, whether it could be useful to go out to mothers and kind of actually talk to them about the types of images which I show you in order to try to engage mothers in the pregnancy, but also the fathers, and possibly help with a better pregnancy and also better health behaviors. So I'm very, very keen on the idea of trying to reduce smoking. At least in Middlesbrough, the incidence of smoking during pregnancy is quite high. I don't know how high it is here, but we want to do something about that, you know, in terms of the health behaviors, and try to see if we can engage parents whether they might actually reduce smoking, okay? It's perhaps a bit idealistic, because when I first of all did it, I went into the hospital, James Cook Hospital, and I got smokers, and I thought, well, now they see their babies, they will be happy to stop. But this wasn't the case. I actually found out that there were lots and lots of other things associated with smoking which actually prevented them from stopping it. So we need to have help, like help of the NHS basically to support the mothers, you know, but also to perhaps try to engage mothers more. And my main idea is that we should look at a pregnancy as a two-patient model. So you have got the mother and you have got the baby or the fetus, you know. And what is good for the fetus might not necessarily be good for the mother, or the other way around, you know. So we have to then evaluate what can we do, or what is best for both of them. So what you get is, when you have got scans, you know, this is just a 2-day scan. You don't see very much at all, but parents are fascinated by it, you know, even just looking at the moving kind of blob, which they can't identify. So how can we take advantage of this idea that parents, when they see their unborn child, they actually want to engage with it and are interested in it? I know that not all of them do it. But before I do this, before I kind of talk a little bit about that, I wanted to show you my methods, you know, how I'm going to do it. So I use 4D scanning, okay, and I look at differences. I mean, like, there are differences between what is an objective kind of way of looking at it, like an academic way of looking at it, and what parents see, okay? And I think both are valid. And of course, in clinical practice, you have to kind of engage with the parents on the parents' level. But what I find is actually the academic background to it, you know, where I can actually say, well, what I'm saying is true in terms of doing my research, okay? Now, the problem with comparisons between different labs who do fetal research, and it's actually over the world. I've written a book, which I'm going to show you here, next one. This is the book on fetal development. And there you get like really an overview of different labs in the world, you know, from Japan to Australia to China, not China, to France, to, I mean, like, it's really all over the world, okay? And what you find in these different labs, they use different methods to actually identify different expressions of the fetus. And they might say, for example, the fetus is grimacing. But what does grimacing mean? You need to have more clear definitions of what you mean by these movements in order to say something about development, okay? So I have developed a system which is called FOMS, a Fetal Observable Movement System, based on FACS, which is a facial action coding system by Ekman, which is being used quite widely in the world. So I use 4D ultrasound, okay? I use this G. Wollesen kind of machine. And I do then frame-by-frame analysis. What I get when I talk to obstetricians, you know, often they kind of say, you know, what about the safety of it? We use BMS, British Medical Ultrasound Society guidelines. So we are at the lower end here, and there is no negative effect in terms of the scanning itself on the fetus. So 4D coding, in my system at least, is essential. In 4D, you can actually see different facial movements, and I've got 19 movements plus touch behaviors which are analyzed, okay? And this is what we do then afterwards. After the videos have been taken, we do frame-by-frame analysis of all these scans. And you can see here, for example, you look at each frame and then you see how long does a mouse touch, for example, last. And you can look at that here as lips parting. Does lips parting and mouse touch happen at the same time? So I've done a lot of studies where it's too much to report here, you know, but looking at the kind of combination of different movements and showing the complexity of the child's or the fetus's behavior. For example, I could show that they're actually anticipating behavior, so their own behavior. So they're getting cleverer in the womb, basically. So this is like the fax coding system. So that's the adult doing it, okay? Do you see this? The adult frowning, okay? You can look at the fetus doing the same. So this is what I'm doing, is I'm actually taking an adult system and I have then developed it for the fetus, okay? So you can see another one, lip pucker. And there you see the baby. So you see here's the mouth, there's the hand, the eyes, the nose. There you can see a smile of this baby here. They are like 32 weeks old, by the way, at the moment. There you can see the smile and the hand moving towards the mouth. And here, that's what we're doing at the moment. We're looking at eye blink in the fetus to see whether eye blink is actually something which shows us attention. So they're listening to sounds and see light, and we look at whether eye blink changes over time. So loads and loads of like academic things we can do, but if you look at it, it looks really nice and very kind of, you know, baby-like, and you just feel, well, if you can show that to mothers, would they perhaps get more engaged because that's their baby, you know? This is mouth stretch. I'm showing you this movement because there I can show you the difference between what I'm doing and what mothers and parents say afterwards. So I've got one comparison of that. And then I look at touch behaviors. What we found in one study is actually that they start to touch more of the top of the head and then going towards a more sensitive mouth area. And here is like touching the side of the face. And when parents see that, when I play a sound, you know, and they see that, they just feel, they can say, oh, the baby doesn't like the sound, you know. For example, when I play white noise, it's a horrible sound, so doesn't like the sound. In fact, fetuses actually do like white noise better than others, and they discriminate between ma, ma, ma and white noise, okay? So, but that's what parents say. And then you can see here is the mouth touch. This shows actually this kind of, when I found like from 24 to 36 weeks gestation, that babies were first of all just touching anywhere in the face, and then afterwards they were actually anticipating this touch by opening their mouth before they're touched. So they kind of anticipate this idea of feeding. And facial gestalts is something, I cannot say that the babies are happy, sad, angry, afraid, or whatever, you know. But what I can say is whether they can actually make the expressions, which as adults we would then identify as those expressions. For example, when they show laughter gestalt, you know, that doesn't mean they're happy, although when you show it to parents, they might say there's a baby smiling, you know. And the cry gestalt is the kind of idea that the baby might be sad to parents, but for us it is actually just to say they can combine all those movements, which are really, really complex, at the same time. So as they grow older, they get more able to have like control over their facial muscles, and therefore they can make more of these facial expressions, okay? Which might have validity for after birth, when they can actually react to parents. This is a cry gestalt, and you need these kind of movements, but you can see that the fetuses actually make these movements, okay? And the next one is pain distress. And you can see there's a difference between the cry and the pain and distress gestalt. That's important if you want them to say something possibly about fetal reactions to certain stimuli, you know. I mean, we can't say that they are in pain, but we might be able to say something how they react to it, you know. Do they react with a cry gestalt, or do they react with a pain distress gestalt, or do they just show a laughter gestalt, okay? So I don't want to say that they have emotions, because I cannot say whether they are emotions, but I can say something about how these movements in the face might relate to certain stimuli from the outside. So is there a pain in utero? Is it possible? We don't know, but we could look at these pain gestalts of the fetus. So in order to look at pain gestalt, you know, what you need to see is there are different studies which have been done on pain in adults, in children, in premature babies, okay? And they look at facial expressions, especially in very young children or babies. You look at the expression in order to identify whether they're in pain or not, okay? And those are the kind of movements which have been identified in the literature, which you can use to identify pain. And I've identified those same movements in the fetus, okay? And so, for example, for the action units of pain, you need at least brow lower, upper lip raiser, nasolabial furrow, and lips parting. You need at least 4, okay? But there are also 2 others which you can use in order to identify it. Another kind of study which might be more in terms of trying to engage parents in the pregnancy was looking at how fetuses react to sound, okay? So sometimes when I've got parents coming in, and especially fathers, you know, because fathers don't have the same engagement because they don't feel the fetus, they are outside of it, you know. But how can you engage them? Well, I sometimes ask them to use their mobile phones even to play a song, because they will tell you certain songs the baby likes and others they don't like, you know. And so you can actually get them engaged by saying, well, then play the song and then look at the baby, okay? And here I did a study in Nepal where I actually found that the babies would imitate at birth, and they still had their cords on, okay? They imitated like O and A, okay? So I didn't stick out my tongue. I thought I was too impolite. And here you can see a baby opening the mouth widely, okay? So in this study, I compared fetuses hearing Ma with a group of fetuses who didn't hear anything. So they heard Ma, okay, and another group who didn't hear anything. Now, the analysis of facial expressions showed that the O movement, the kind of movement which is like the pre-feeding possibly, you know, happens as often as this R movement, okay? And there you see the kind of pursing of the lips, you know? And we compared that, okay, for the fetuses who didn't have any sounds, and we found from 32 to 36 weeks gestation that the fetuses who were in the sound group increased these Ma movements, okay? And the fetuses in the no sound group didn't do that, okay? So they seemed, the fetuses in the sound group hearing this Ma, Ma, Ma would actually react to the sound by opening the mouth. They wouldn't do the O, because you can see here the sound group was as low as the no sound group, okay? When you kind of show parents, okay, 4D images, and you let them play, sorry, you let them play even their own sounds, you can see that the fetus will react in some ways. It might not be this exact thing because this was an experimental study, you know, but it actually makes a difference because you just saw your reaction. When you hear the sound and you see the baby reacting, it does make, it has an impact, okay? So I thought one way of looking at getting parents more engaged, especially fathers, would be by doing kind of this kind of engagement through certain stimuli, you know, and you can let them bring their own stuff, you know. So just to see when you visualize the fetus and then you see the newborn baby, you can see they already look very, very similar. And you can actually point out, which I always do with parents or with fathers, you know, like for example, looking at mouth shape, you know, is it the mother's, is it the father's, you know, one thing. Or if there is nothing happening at all, I saw like one father would kind of cross his legs and the fetus would cross the legs, you know. And we couldn't do anything on the face because it wasn't doing anything. But crossing the legs, you could just say, well, look, the baby's doing what you're doing, you know. So in that way, you can actually engage them, you know, and hopefully produce better behaviors, just better caring behaviors, which then result in better health of the fetus. So just to show you the scientific approach and the parental approach. So this was the approach looking at a single movement, which was this mouth opening, okay? And we were looking at yawning, you know. So I looked at the mouth opening just as opening and closing, or yawning, which is like the dynamic of the movement. So it kind of opens and then closes very fast, okay? So there's a difference between yawning and just mouth opening. Now, yawning might be important for development, okay? So definitions of yawning are, there are various people who have defined it, and I have kind of looked at this dynamics of the yawning definition, okay? And you can see here, like here is a simple mouth stretch, which is just opening and closing. So it goes up and down, you know, and then yawning. So we just analyzed that, and the difference between, it was like the apex, which was different, you know, for the yawning, the apex is lower down, and for the just mouth opening, it's same opening and closing, okay? And you can see here there is a significant difference as they grow older, from 24 to 36 weeks gestation. They have got higher yawning rates, you know, that's why yawning might be actually important developmentally for the jaw, and then the non-yawn mouth openings, okay, which go down to nearly 0 at 36 weeks. So yawning might trigger brain maturation. That's like one study, which is loads of studies have been done with animals, with rats especially. And so the movements actually trigger the areas in the brain which are necessary for cognitive development. It is activity-dependent brain maturation. So there are kind of different explanations which are perhaps not that interesting, but now you get the parents' view, okay? I had published this article, you know, it got quite a lot of press, and then this mother here actually wrote to me. I mean, really nice, you know. She said here, my son Maxime was born in September, at 32 weeks pregnant. My husband and I thought it would be fun to have this 3/4D scan, and we were amazed at Max's facial expressions in utero, especially the yawning, you know. So yawning in utero is actually something parents are quite engaged with. Again, you know, looking at how we can engage them by having like videotapes of that might help, okay. So they were amazed at the facial expressions, and then they said, I thought yawning in utero was common, which is true, you know. Contrary to the article, which was my paper, you know, however, I do believe it was because Max was tired, because I said everywhere in press releases and everywhere, it has nothing to do with being tired, you know. It's something to do with maturation, you know. But she said, no, it's because he was tired. For the first half of our video, Max was asleep, okay, so another kind of idea. The yawning came after he woke up and started moving about. I didn't think it was a coincidence, as his yawns after he wakes now, after birth, okay, are similar. I think a growing baby gets tired now and then, she said. So you see the interpretation which she gave me was different from my interpretation, but it's completely valid for the way she needs to interact, you know. So I think to say it's wrong is definitely not good to say that, you know. And then she said, interestingly, he also laughs. And then she said, in fact, he laughs now in the same way as he does when he wakes up. So what I think that shows is that parents show their emotional attachment to the baby. And they kind of give interpretations of this kind of interaction, you know. And these interpretations are important, okay? Now, I base like my studies always on movements. So I ask them, you know, like, do you see this movement? And then they give an interpretation of the movement, you know. So we can debate whether we should talk about feelings or whether we should talk about movements. So I think that it's important to look at this relationship, and that we need to change our idea of the mother and the fetus as being one unit to actually saying, well, in fact, it's a two-patient model, you know, and we have to kind of engage the parents, both mother and father, as one kind of unit, and the fetus as the other one. And then we have to kind of think, well, what is important for the health behavior of the mother, you know? If the mother is completely stressed and says to me, well, I need to smoke in order to reduce my stress, you know? Although we did this study, we actually looked at stress in relation to movement, and also just in relation to and nicotine consumption, okay? And it was actually the nicotine consumption which had a much bigger effect than the stress on the fetal movements. So for the fetus, definitely the nicotine is worse. And therefore we need to also look at, for example, NRT. People now in the NHS kind of says, well, we need to have NRT in order to treat mothers who are addicted to smoking because of all these poisons which are in it, you know. But in fact, it might be better for the mother cells, but it's not clear at all whether it's better for the fetal health, okay?
Do people know what NRT is?
Nicotine replacement. Oh yeah, tell me, what do you think is nicotine replacement? I asked so many mothers that. What do you think?
Nicotine patches?
Yeah, but what is a nicotine replacement? How does it replace what? Pardon me? It doesn't. I mean, like, it's the poisons, you know, the additional things of the nicotine, of the cigarette, you know, which are reduced. They are eliminated more or less. But the nicotine itself is as high or perhaps even higher. So I've got the idea of this questionnaire, which I produced before, you know, and got some comments. What I thought is, you know, it would be perhaps when we kind of engage parents more and kind of talk about the fetus, it might help them to engage more in the pregnancy, you know. The problem is, of course, with 4D scans. Everybody tells me they are too expensive. I would love for everybody to get 4D scans, okay? So people say it's too expensive. Now, the next step would be perhaps do a questionnaire. Looking at attachment with these fathers and mothers who I saw at 24, 28, 32, and 36 weeks gestation, so 4 times, okay? And every time when I saw them, I would give them this attachment questionnaire. And what you can see here is, so this is like the 24 week, which I just showed you, and you said, oh, it looks nice. And that is 36 weeks, okay? You can see that as they grow older, they become more baby-like, and then in the end, you can actually see already the similarities between the fetus and the baby at this older age. And you can see here with fathers, you know, like as the baby grew older, and they saw the scan, of course, they were increasing their attachment. So there must be something in that seeing the scans might actually help them to attach, you know. So it is lower than that for the mother. And you can understand that because the mother is, of course, engaged with this completely, you know. But it actually comes to near similar points at the end, you know. So fathers need to be prepared for the baby arriving as well, you know. So in a way, I thought this would be a way of doing it by showing them 4D scans. And I mean, this is what I did with 4D scans, but if you have got the opportunity to see them several times and seeing whether actually talking about the baby increases attachment, that would be a really interesting study. So we can have different methods, okay? There are these prenatal attachment questionnaires, which are well developed, you know, and you can have like interviews with the parents, and then you could have a YouTube kind of thing in the waiting room. I haven't produced any of these YouTube channels, which there are 2 at least I know about, okay? One which has got like 1.4 million views or more, okay? I know it's kind of, I haven't done it, okay? They just took things, okay? And this one, which I want to show you, is actually only 236,000 views, so it's not that many, you know, but at least I thought it was quite good, and it could potentially be used for waiting rooms, you know, for example, see whether that might help. So there could be a staged approach to assessing prenatal attachment and the concept of the fetus, okay? And then each stage would need to be tested, basically. So the other thing is a questionnaire, okay? Now I have used this, I sent it around to several people and got kind of comments back, so it needs to be changed, definitely. But this was just the first kind of idea, you know, of how to engage them. And I said we should kind of ask them to describe pictures. And by describing pictures, hopefully we get some sort of idea of when they say something about it, that they also express what their relationship is with it, you know, rather than talking about what you feel when you see it, you know. So I'm not sure. I mean, that's something, again, for you as a group, because you have all the experience, you know, to kind of tell me about.
And I think the family mentals will recognise that we use Nadja's images in the first handbook, don't they? And we do an activity, which I sent to you, haven't I?
Yeah.
Talking about that sort of thing, how
Yeah.
it feels.
But it would be good to kind of get then an idea whether, does it make a difference, you know? So that's the next stage. We need to find out whether just talking about them makes a difference. So you have got like facial expressions here, you know, and then you can kind of tell them, can you describe the facial expression? And then perhaps, how do you feel when you see these expressions? Perhaps we can have both, you know. So I mean, like, I would be, again, interested in your opinion on that, okay? But it's really important, rather than just doing things without knowing what the effect is, we need to kind of, in a way, test afterwards, what is the effect, you know? Does it actually make a difference? Or is it just, you know, like an activity which you could spend the time better on something else, because your time, of course, visiting these mothers is very limited, isn't it, you know? So how to increase then attachment? I said, and I still believe that, you know, that if we can have 4D scans, it will increase parental attachment, you know. So the idea is then, okay, we could have a questionnaire, which is just a questionnaire with a fetus of any age, okay. We could also kind of get a questionnaire with images of their own fetus, you know, if we can get a few images taken from a scan, you know, of their own fetus, because it might be kind of having a bigger effect, you know. Or you could show them a video of a fetus and then see the reaction, for example, the ma video, you know, to see whether they might react to that, you know. Or the best, I think, would be to actually show them their own fetus, a 4D scan, talk about this fetus, and then perhaps they have got the scan there, so afterwards you can go back to the home and actually talk about several times. It doesn't have to be just once, you know, because often they kind of do the scan, they look at it, and then it's gone away. But you can actually make use of it by talking about it more over the pregnancy, you know. So I just want to say again, it's really, really important to have this system where you can objectively test fetal expressions, you know, rather than just saying it's grimacing or it's whatever, you know. We can actually say, well, here are the objective tests, and we can prove, you know, that this is a difference, this makes a difference. That's why I think my system is important. So the idea is you get diagnosis, like with 4D scans, of course, diagnosis of deficits, maternal health behaviors, and then parent-fetus attachment, and that then leads to decreased postnatal deficits and decreased NHS costs.